Hi, I am K. Radhakrishna Menon, Vice President, Content Development and Training and Conference, National Association of Palliative Care for Ayush and Integrative Medicine. I would like to share with you a topic on home health nursing that is being rendered by Colonel Dr. Yashwant Joshi, Vice President, Advocacy and Awareness, National Association of Palliative Care for Ayush and Integrative Medicine. Home health nursing is a nursing specialty in which nurses provide multidimensional home care to patients of all ages. Home health care is a cost-efficient way to deliver quality care in the convenience of the client's home. Home health nurses create care plans to achieve goals based on the client's diagnosis. These plans can include preventive, therapeutic and rehabilitative actions. Home health nurses also supervise certified nursing assistant. The Professional Nursing Organization for Home Health Nurses is the Home Health Nurses Association or HHNA. Home health care is intended for clients that are well enough to be discharged home but still require skilled nursing personnel to assess, initiate and oversee nursing interventions. History. Lillian Wald is recognized as the pioneer of public health nursing. She established the Henry Street Settlement, which served underprivileged individuals and families. Nurses and social workers that worked at the Henry Street Settlement visited patients in their homes, assessed their health needs and provided support with hygiene, nutrition, immunizations and more. Wald was able to convince Metropolitan Life Insurance Company to cover home care services. This allowed public health nursing to shift from charitable work to profitable work. A role and responsibilities. There is a wide range of services that are performed by many different professionals. Services include wound care, disease management, medical equipment, therapy, medical social services and patient education. Home health nurses have a wide range of duties and services provided, and in addition to services provided, nurses also consult with doctors on the status of the patient and provide feedback on any potential changes that need to be made to the care plan. Some responsibilities that home health nurses take on include promoting health and disease prevention, medication administration, educating patients on their current diagnosis, providing emotional support and providing basic care such as personal hygiene. Nurses also step into the role of case managers, meaning that they coordinate services from different disciplines for the patient. This include rehabilitation, pharmacy, community resources and more. Providing the most up-to-date and effective care for a patient is also a very important part of a home health nurse's job. They do this by continually keeping up to date on the latest research and evidence-based practice. Educational certification. Home health nurses can have a nursing diploma to be a licensed practical nurse or have an associate of science in nursing or bachelor of science in nursing. They can then sit for a test through the American Nurses Credentialing Center that will allow them to become a certified home health care nurse. Scope and standards of practice. The scope of home health nursing is directly related to the nursing process. This includes assessment, diagnosis, planning, implementation, and evaluation. The standards of home health nursing integrate research, education, proper use of resources, the quality of care provided, team collaboration, and ethical principles. Barriers to home care nursing. Home health nursing is a unique field considering the obstacles faced by the healthcare professionals. When out visiting clients, the nurse is alone and is not able to rely on others most of the time. Nurses in home health care must learn to be autonomy. The variety of home condition that a nurse will step into can also present problems. Cleanliness and safety play a large role in client care. Not all homes are equipped to provide a clean environment for the client. Environmental issues in the home include unsanitary conditions that allow for bacterial growth and conditions that may increase the risk of falling for the client, such as poor lighting and area rugs. Education regarding this is important for the nurse to share with the client. Medication adherence is also more complicated at home. Unlike in a hospital setting, the medication is scheduled around the clock and readily available. It is really dependent on the client's resources and financial situations. Also, client compliance or client adherence to the plan of care factors into client health outcomes. Eligibility. Home health care is generally less expensive and more convenient than in the hospital. When possible, home health care helps regain independence, become more self-sufficient, and maintain current level of function. The primary payer for home health care is Medicare dependent on meeting certain eligibility criteria. Home health services are covered when all of the following criteria are met. Patient is under the care of a doctor and getting services under a plan of care established. A doctor certifies that the patient needs one or more of the following: intermittent skilled nursing care, physical therapy, speech language pathology, and continued occupational therapy. Home health agency caring for patient is approved by Medicare. Doctor certifies that patient is homebound. As part of eligibility, a doctor or healthcare professional must document that they have had to face encounter within required time frame and the reason was related to need for home health care. Eligibility for home health care is determined by intermittent skilled nursing care that is needed fewer than 7 days each week and daily less than 8 hours each day for up to 21 days. If skilled nursing care is needed more than this over extended period of time, it would not qualify for home health benefits under the Medicare guidelines. Thank you.